Do you have an L4-L5 disc bulge and you're frustrated or worried that it's not healing and the recovery time is just taking such a long time? Well, in this video, I'm going to give you five ways that you can speed up an L4-L5 disc bulge recovery time. I'm going to give you 5 of these things, so stay tuned and keep watching.
Helping you relieve pain, conquer stress, and supercharge your health the chiropractic way.
Hi, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And I've seen many patients in the office that suffer with L4-L5 disc bulge or L5-S1 disc bulge and the related symptoms like back pain, leg pain, trouble walking, and everything that relates to that. And I can tell you it's one of the most debilitating conditions that someone can go through. And if you're going through that, you know exactly what I'm talking about. And oftentimes, one of the most saddest things that I see is that a lot of people suffer with this, with an L4-L5 disc bulge and the related symptoms for a long time, like months and sometimes a year or even 2 years by the time they come to an office like mine. And it just doesn't have to be like that. And a lot of times I've noticed that these 5 steps that I'm going to go over with you have often been missed or just plugged into the wrong order. And it can make a massive difference. And if that's been your experience, I want you to understand it's not your fault. It's very possible that you did the best you could. You were just misled and misdirected in whatever you chose, whatever path you chose, and whatever doctor you listen to get help from. So what I want to offer is these 5 often missed steps that can help speed up the recovery time of an L4-L5 disc bulge or even an L5-S1 disc bulge, even if it's been chronic, 6 months, a year, 2 years that you've been suffering with this. And these are the techniques and the strategies that I've applied with my patients that have made a massive difference in helping people speed the recovery time of an L4-L5 disc bulge. So the first thing to consider, this is super important, and it's probably the biggest mistake that I've seen people do. Again, no fault of their own because they don't know, right? You're going to an expert for help, but they've been misguided, is you need to focus on correcting structure first versus function. Structure versus function. Why? Because the structure of your spine dictates your bodily function. So let me demonstrate. Here's a spinal model, okay? And normal alignment of the spine, lumbar spine should be straight over here from the front and then a natural elliptical curve from the side. Normal alignment is ideal position, right? So if the structure is distorted, let's say it's laterally bent, or the sacrum is tipping down to one direction because of an anatomical short leg, or there's a loss of lumbar lordosis, or too much lumbar lordosis, or an anterior listhesis. So any of these structural distortions, misalignments of the spine, they will insult and will irritate and will create abnormal load distribution, body weight distribution on these discs. And a disc that has abnormal weight distribution because of misalignments will never heal properly or quickly until the structure is addressed. So the common mistake that I see is that patients come to me and say, I've been to the therapist and they gave me all sorts of back conditioning exercises, bridges, planks, stretches, right? And what they're focusing on is function before structure. There's a place for that, which I'll talk about, but you want to look for a doctor that focuses on correcting structure first and then function. And that's the type of work that we do as a corrective care chiropractor. But remember, focus on correcting structure versus function first. Strategy number 2, get the right exercise done at the right time. Again, one of the biggest mistakes I see patients do. So they come to me and they tell me, I went to the therapist and I've been given all these exercises: core strengthening, planks, bridges, side planks, bird dog, dead bug, all these things. And we teach these things, right? But they got to be done at a certain time. So we don't start with conditioning, strengthening exercises right off the bat. That to me is a mistake. And I've tested that out and it just didn't work out with my patients. So what I start off with is with mobility exercises. You want to enhance the mobility of your spine, of those lumbar disc areas. Get some fluid and nutrition to imbibe into those disc areas because that will bring fluid and nutrition in there and then excrete or get rid of byproducts from the inflammatory process that's irritating the disc. So easy, gentle mobility exercises like pelvic tilt, cat-camel exercise, standing extension exercises. These are things that we give to our patients that will ease them in at the right time at the beginning to help with mobility of the spine. Then later on, I'll get into some stretching exercises in the lumbar spine. You can't start with stretching your lower back at the very beginning when there is a serious acute disc injury or disc pain, or if it's been a chronic disc pain that's just been active this whole time. So there's a time and place for that as well. Once the pain and inflammation subsides, then now you're going into repair phase and eventually remodeling phase of the healing process. Then that's when I get into the stability core strengthening exercises done later on. So for most of my patients, they don't get that until 4 or 5 weeks later. So like I said, step one, focus on the structure first. Correct the structure of the spine, work on that. In the process, irritation, inflammation is subsiding, and chiropractic adjustments help with that. Corrective chiropractic care helps with that. Then initiate with the proper order of exercises, light mobility exercises, pelvic tilt, cat-camel, standing lumbar extensions, maybe some prone lumbar extensions, then some stretching exercises, and then your core strengthening exercises. And then later on, we get into a balanced proprioceptive exercise as well if we can get to advance down the road, okay? That would be the order that I would get my patients through. I've done that with my patients. I had one gentleman who had a disc injury and L4-L5, also L5-S1, giving him crazy leg pain shooting down the leg. He couldn't do stretches at the beginning. He couldn't do core stretching at the beginning. He couldn't do dead bug at the beginning. So we did adjustments. We did some postural corrective work, working on the structure. Pain is subsiding. I gave him some sciatica nerve glide exercises, very low key mobility release exercises, some pelvic tilt exercises in here in the office with our wobble chair at home seated. And now his pain is subsiding. Now we're going to focus on strengthening that core musculature, fascial connection to the lower back pelvic region to help hold the corrections in place. So that's the way that I would suggest if you're talking to your therapist, doctor, or chiropractor to do in that order. Strategy number 3, multimodal treatment approach. What does that even mean? That means using a variety of different types of therapies to help with the treatment process. So I'll give you an example. So I'm a chiropractor. I focus on chiropractic structural correction of the spine and structural rehabilitation. Now, I don't do laser therapy or acupuncture or muscle e-stim or ultrasound in my office. And some chiros do, and that's perfectly fine. It's just not what I focus on. But some patients may need adjunctive therapies on top of the corrective care and structural rehab that we do. So I often refer them to get laser therapy, for instance. Laser therapy can help enhance and speed up the recovery process, reduce inflammation, and promote the healing process of those injured tissues. Sometimes they may have an adjunctive therapy like acupuncture. I've had patients that have done acupuncture in conjunction with corrective care and chiropractic adjustments, and they healed a lot faster. And again, adding the exercise and the active component by the patient, that's also another method of multimodal treatment. And sometimes patients may need pain injections or medicines with their medical doctor and specialist. That's not in my scope of practice, but if they need it, I'll tell them to go talk to their physician about that. And that can be part of the multimodal method as long as they're getting the corrective functional parts done as well. So multimodal method approach can help enhance the speed and recovery of an L4-L5 disc bulge or an L5-S1 disc bulge. Number 4, it's super important. Stay on track with your recommended treatment program. I can't tell you how much of a mistake it is to fall off track or not show up for your recommended treatments, regardless of where it is that you're doing it. I have a patient that has missed many of his visits for a lot of good reasons, unfortunately, personal reasons, death in the family, eventually vacation. And unfortunately, he had a spine that had a lot of disc bulges in the lumbar spine, abnormal postural alignment, lots of pain in the leg, in the back, in his neck, in his arm. And you start missing visits, your recovery is going to be slower. Have other patients that come in. Had one guy who came in with, again, an L4-L5 disc bulge and low back and leg pain. He did not miss a visit, and he stayed up on track, and he recovered really well. So staying on track with the recommended care program that your practitioner, chiropractor, therapist gave you, usually based on the successes and experiences of other patients. That's why we give these programs, because we know they've worked with others in most cases, is important for your recovery. The quicker recovery you want is important to stay on track with your recommended treatment plan. And number 5 strategy, just as important than number 4. Do your homework. Had a patient that came in today, and I was planning on this video right here, and she said, Dr. Walter, before you open your mouth, I want to tell you, I didn't start my exercises yet. And I go, no problem, we just gave them to you last week, but get on them today. And I told her that's one of the actual things I'm going to teach in this video, because you have to do your part. The more active you get involved with your healthcare, the faster you're going to heal. Patients that do their recommended treatment, home treatment like exercises, postural correction, home traction, rehabilitative home exercises are the ones that are going to help support the in-office passive treatment by the therapist and chiropractor. So do your homework. The more you do for yourself, the faster you're going to recover in conjunction with showing up on time and for your treatments in whatever office you're in. So do your homework. Super, super important. Now that you heard these 5 strategies, let me know what your thoughts are. Comment below. Tell me which one of those 5 steps that you think you've missed. And again, whether, it's not your fault if you missed them. I'm just curious which one of them maybe didn't work out for you, which one was missed, which one was maybe miscommunicated, and tell me which one you think that you could actually improve upon. And if you want to get more information about L4-L5 disc bulge, L5-S1 disc bulge, how it's even injured, the anatomy involved, and some exercise that I've given to many people that could help at some stage in your healing process, go ahead and check out this video right here. It's my most popular video on my channel to learn and continue learning about this nasty condition, L4-L5 disc bulge.